Cindy Lazinski is on her way to work. She's a nurse with Poudre Valley Health System in Fort Collins, Colorado. But Cindy's work is mostly outside the hospital. She's a community case manager who oversees the care of clients at their homes.
Many of them are elderly. They're vulnerable. They may fall through the cracks of the healthcare system. They have a lot of chronic illnesses.
Clark Long is a typical client. He has heart disease, liver disease, and other medical problems.
I've got, 5 or 6 different things I'm taking medication for and everything.
110/62, that's good.
Cindy has been seeing Mr. Long for more than 5 years, monitoring his health, making sure he's taking his medications, and getting to the doctor when he needs to.
Nice and clear. I think the biggest thing we do is provide this dependable presence that they count on. And the longevity, I think, gives them some security knowing that somebody's going to be checking on me.
Well, I'm glad to have her come. I'm glad to see her. And I'm glad to talk with her.
I know it's kept Dad healthier. I know it without a doubt. She really did a in-depth study on what he was taking, and we've cut down the amount of pills he had to take by 1/3, and which also helps financially.
So your oxygen level's 95, that's good. Your heart rate is 77.
Cindy is one of 5 nurses and 1 clinical social worker in the Community Case Management Program. It was started in 1995 by Poudre Valley Hospital, a magnet hospital, and winner of the 2008 Malcolm Baldrige National Quality Award.
Our job is to keep this community healthy, and this is one facet of how we achieve that.
Hello.
Good morning, Deborah.
Good morning. How are you all? Okay, Mr. Keck, I just want to check your blood pressure, listen to your heart and your lungs, and I'll look at your port, too, while I'm checking things over.
The program was developed by the case managers themselves after assessing the needs of the community. Currently, the case managers are supervising the care of about 400 clients. Some they see for a few months, others for years.
Yeah, this one is a little bit, you can see where her sock is. I work as an advocate for them. I'm a coach to them. I'm a resource for them to help them manage their health care, and it also is more than just their health care, sometimes even their living situation.
Oh, I would say our #1 goal is to, #1, primarily to help each client meet their own goals, and usually it's to stay in their home, and so to keep them safe and healthy as much as possible.
And sometimes they just are slightly cognitively impaired or overloaded with the healthcare system, which is increasingly cumbersome. So let me get your blood pressure, Alice, and see if everything's A-okay with that.
All of the nurse case managers are advanced practice nurses who have extensive experience in clinical care.
106/66.
The benefits in this program is that all of these nurses are long-term skilled clinicians who know sick from not sick and are able to really help work through the medical establishment. These tend to be very disorganized people. Either because of mental health problems, substance abuse, homelessness, financial reasons. They tend to have a very hard time following through with recommendations, and the community case managers do a phenomenal job of helping them.
I would probably get more of the folks that might have substance abuse, that have probably personality disorders that are long-standing, and then on top of that now have a chronic illness that they're trying to deal with.
The people that I see are the people that have a high ER visit rate, don't really have a primary care physician, so they use that as their doctor's office.
One of the primary goals of the program is to prevent unnecessary trips to the ER and reduce hospital admissions. That's good both for the clients and for the hospital.
Well, it's a terrific community benefit, and what we see is that if you're able to manage these chronic illnesses without having to be in the hospital itself, it's just better for everybody.
We've consistently, as we've been keeping outcomes over the past 13 years, we consistently see ER visits drop in half if we compare the ER visits of these clients 6 months before we see them to 6 months after. ER visits drop in half, and inpatient visits usually drop in half.
Poudre Valley Health System pays for the entire program. There is no cost to the clients.
I'm for it 100%. I just think it's invaluable, and I'm just amazed that, that they can provide this service free of charge to the community.
It establishes a great relationship between the healthcare system and the community. People are just amazed when we tell them there is no charge for our services.
But when it gets to the point that older folks can't get out, they're not mobile. I mean, what do you do if you don't have a system like this, you know, where people come to the home? So it's, you know, it's a wonderful thing.
And just put this on your finger here.
While the program is a free service, the case managers have documented they save the hospital more than twice as much as the program costs.
The goal is to keep them from getting sicker, or keep what maybe is a small thing to start with becoming a big thing, and then they do have to be admitted.
If we can keep people out of the hospital, it's certainly going to control cost and help patients.
And if they aren't coming to the emergency room, to me that means they really are doing better in their own environment. They aren't feeling as sick.
Since the program is not restricted by the regulations of Medicare, Medicaid, and insurance programs, the case managers have a lot of flexibility to meet the needs of their clients.
You're often faced with things that the traditional healthcare system can't deal with, and your hands aren't tied from assisting patients to get problems solved.
We help them find affordable programs, sign them up with Medicare D plans that they can't figure out on their own, and even look at mail order or other places that can help them get their medicines as easy as possible, and also help them keep track of when do they need to renew medicine. Sometimes that gets to be a little bit confusing.
When we go to somebody's home, we may go in with a certain idea of what we're going to work on today, but we may find there's no food in the house, or again, there's been a disagreement between family members and we have to work on that, and we can change what our goal is for that particular visit.
Hospital leaders think community case management may be part of the answer to help contain the cost of healthcare nationally.
It's one of those programs that I would say is definitely best practice in the industry, and something that if we could just keep replicating the outcomes that we're seeing there, it's just it's something that I would assume is really going to catch on, and every health system will be kind of jumping on that bandwagon.
I think there's a lot of hospitals and healthcare systems in this country that could be doing that, and maybe looking at fixing the national healthcare problem locally instead of expecting the government to fix it.
It would make better use of the money we do spend, and it would provide better care to patients, and I think better satisfaction rates as well. So both for the medical providers and the patient.
For the clients and their families, the benefits of the case management program can't be measured just in dollars and cents.
Someone who doesn't know any more about medicine than I do would be at a loss without that kind of service now. If it weren't for this program, I don't know where I would turn.
You know, I can't imagine not having a program here after I've seen what they do, you know, and they come in, they're friendly, they make them feel like part of the family.
You can't underestimate the value and the blessing you bring to people with this.
Oh yeah, I think it's the best job in the world. You can't beat it, because we go out to these people's homes and they want us to be there. We look at a little piece of their life and figure out how can we make it better. And at the end of the day, we go home knowing that we've made a positive impact.